Ambulance provider AMR is just about in full compliance with Multnomah County standards, a few percentage points off from meeting every metric. A year ago, that was nearly unthinkable. So how'd we get here? In August, Multnomah County leaders and AMR agreed to a compromise. They allowed AMR to staff some ambulances with a hybrid model of one lead paramedic and one EMT, instead of requiring two paramedics for all life-threatening calls. AMR said this change would help them get more crews on the roads, something everyone wanted to see, and it's worked. This graph shows the increase in the number of on-shift ambulances over the last 6 months, from 300 active shifts on the left side to more than 500. And in the bottom of this chart, you can see that number of two paramedic or hybrid ambulance crews working each month has grown from 33 to 52 since August. AMR leaders say this has been a game changer for first responders. Here's Rob McDonald, AMR Regional Director, in a presentation to the Multnomah County Commission yesterday.
Near the end of 2024, it was not uncommon for our crews to run as many as 10 or 12 calls in a 12-hour period. Crews are now running a much more manageable 5 to 7 calls in the same 12-hour shift. This workload mitigation has provided an improved work-life balance for our paramedics and EMTs. We now have the power to mitigate workforce fatigue and burnout, whereas prior to the settlement agreement, our workforce was simply surviving under an onslaught of call volume with limited resources to respond.
At the heart of this subject is one question. When I, you, or anyone calls for an ambulance in Multnomah County, will they show up? Throughout our reporting, we focused on a concerning category called Level 0, a code that means all ambulance crews are tied up and dispatchers have 0 available ambulances to send to a new emergency call. In our investigations, we found thousands of emergency calls that went unanswered, leading to potentially disastrous outcomes. Fortunately, with the new settlement and as things stand, Multnomah County residents don't have to live with that fear anymore. AMR has all but eradicated Level 0 cases.
Prior to August, it was common to have as many as 20 to 30 hours a week where no ambulances were available to respond to a 911 call. Working with Multnomah County EMS, we have been able to drastically decrease the occurrence to just minutes a week, and in the last week of March, that time was 0.
But there is still one area where AMR is missing the mark: response times. The company is required to respond to 90% of life-threatening calls within certain timelines. In urban areas, that threshold is 8 minutes. At last check, AMR is now at 88% compliance. This chart shows the improvement. Look at the yellow line there that drops down into the blue. For nearly 2 years, AMR hovered around 60% compliance at its lowest. That meant effectively 1 in 3 ambulances were late in getting to an emergency call. Still, the improvement since the hybrid staffing change is clear to see on the right-hand side, and McDonald thinks AMR is almost there.
One of the most difficult things is the last 2%. Thankfully, that we're working very closely in partnership with Aaron and his team and my team. We're pretty confident that all data points to we should have this thing done.
Multnomah County commissioners and EMS leaders said they were impressed by the improvements, even if response time compliance is still a couple percentage points away. But county leaders still view the hybrid model as a short-term change, with the goal of eventually reverting back to a 2 paramedic requirement. Here's County Health Officer Dr. Richard Bruno.
The agreement was intended by both parties to be a temporary change, a stopgap to allow AMR sufficient time to hire enough paramedics and EMTs to adequately staff enough ambulances to meet response times.
If it is working, why switch back? The main reason from the county's perspective comes down to health outcomes. Key county leaders believe that 2 paramedics provide better patient care than 1 paramedic and an EMT, but they don't know that for certain.
I don't think we can give you a good answer about whether the quality of care has changed between a dual-staffed ambulance and a hybrid ambulance at this point, which is why we're getting somebody on board to be dedicated to answering that question.
Potentially clarity in the future. So if there aren't any major differences in patient outcomes, if that is what we learn, could Multnomah County and AMR make this staffing change permanent, this 1-in-1 model? Commissioner Julia Brim Edwards is floating the idea.
is there some impact on the quality of care? Because if not, it's like, then like we shouldn't be making a more permanent shift to something like this if it allows us to get more ambulances and speed up the delayed times.
And lastly, there's still an issue of more than $8 million in outstanding fines that AMR racked up for late arriving ambulances. The county and AMR will revisit the settlement agreement, the fines, and future steps in August. So what is going through your mind? Do you think the county should stick with the one-on-one model? Since it appears to be working in this case, why or why not? Email the story at kgw.com or call and leave a voicemail 503-226-5090.